Good evening, everybody, and welcome to RAMP, Real Access Motivates Progress live podcast. We are sorry that we are running late tonight, but with all thing COVID, we roll with the punches here. So we're a little bit late, but the show is well worth the wait because we are here tonight with Oakley's Home Access and Justin Oakley, one of the co-owners. Hi, Justin. Welcome to the show.
Hi, Tina. Thanks for having me.
It's always a pleasure to talk to you and, learn everything about Oakley's. But why don't you tell all of our guests and remind them who you are and what you do?
Excellent, will do. So, yeah, my name is Justin Oakley. I'm an occupational therapist by training, and I've partnered with a construction expert named Michael Vieira, and together we formed Oakley Home Access. So we are a full-service home access equipment, home modification company serving all of Rhode Island, all of Massachusetts, and all of Eastern Connecticut now. We start off the process with a free home safety assessment. We're able to go room by room, making recommendations of a wide variety of access equipment, anything from grab bars, stair lifts, ramps, now elevators, and we're able to install anything that we determine with the family that might be a good fit for them to maximize mobility. So we're all about aging in place, fall prevention, and increasing accessibility, just like you, Tina.
Oh, that's great. You guys do such an amazing business and anything that you want. I love your showroom because your showroom is interactive. You have a lot of the pieces set up so people can touch and feel and try out the equipment. I know you're sitting in your showroom now because I know that shower that's sitting behind you. So tell everybody a little bit about where your showroom is and what they can expect when they go there.
Yeah, so we are down here in Narragansett, Rhode Island, here in South County. And we have a nice sized showroom here with just about everything that we are able to install. Folks are able to come here and try out. A lot of times, healthcare providers are telling loved ones that they can benefit from equipment that they may have never heard of. And why we have this all set up is folks can come by and they can try it all out for themselves. They're able to come ride a stair lift if they've never tried one. They can push mom up and down a ramp if they have never dealt with a ramp before and are considering it in their home. They can try out the grab bars. They can look at a wide variety of grab bars. Also, there's a VPL here. There's a full-on elevator that they can jump in and press the button and ride on up and see if it's for them. So we're also really big on customer service. A lot of times when the phone rings and folks are looking for our help, we always say they've got this going on. They're up against it most of the time. Oftentimes it's crisis situation. So we're able to help them. We're able to talk to them about all aspects of the project. And what initially, when someone maybe mentions ramp or stair lift, it may be an overwhelming situation. And we try to, simplify it and break it down and make it more achievable and just simply increase quality of life and maximize their mobility and try to give them their options, but try to break it down and really make it simple for them. A big piece is the funding issue. Everyone's always asking, who's going to pay for this? So our staff is always here, ready to help anyone and everyone in need.
That is amazing. And I know that you had come out and you guys installed my chairlift for so I could get down to the basement and do my own laundry at my new Habitat house. And there is a video that brings you from soup to nuts. And let me tell you, what an impressive setup it is to watch how they set the markers on the floor and they measure everything. And the installation, there was no mess. There was no time. It was just completely seamless. But what I like best about you guys is you really go out to the property and you assess the situation and you don't oversell anybody. You tell them the basics, you give them the options and you tell them how to do it. I think that's amazing because not many companies do that. They want to oversell, they want to overprice. but you guys bring it down to bare basics so we can age in place. Like you even came out and helped me with some of the shower bars that I needed because mine weren't properly placed at first, and you guys came out and fixed that. So tell the people a little bit about the process of going out to somebody's home and how you go about the process of assessing what they need.
Right. So yeah, it was all. I was inspired when I was as an OT working in a skilled nursing and rehab setting. So we would through Medicare offer a home evaluation where when we weren't sure of how a discharge was going to go because of a change in status, change in mobility, change in function, we'd take them to the home and we would go room by room and we'd ask them to get up and down from each surface, in and out of each space that was going to be utilized, and we'd make a lot of recommendations. So, and at that point, we had nothing to do with them. We told them, we preached to them what they should do, and we didn't really have a resource to send them. So that's what we do now. That we modeled our free home safety assessment after that procedure, after that event that we would do. So we go room by room. We start with access, in and out of the home. What's your favorite way in? What's your favorite way out? Let's look at all the entrances, all the exits, and let's find out the best one that we can, minimally invasive modify to maximize mobility. Oftentimes, it may be the third entrance that they hadn't really thought of that is the best one for all the variables involved. We're often almost always going into the bathroom. As an occupational therapist, that's the main event for me. It's such a dangerous place sometimes where it can be an enjoyable place, an important place, an essential place, but there's dangers there. There's a lot of variables. We're often fatigued when we're in there, either early in the morning or after a long day. It's wet, it's slippery, it can get foggy, and there's just a lot of slip and fall hazards. We love to point out what we see. Not any situation is unique. So we look at the person and we're looking how the person is interacting with their environment. So we talk about which spaces we're using. If the person is with us and not at a hospital or a nursing facility, rehabbing to get home, if they're there, we ask them to go through the motions if they're up for it. We're able to see where they're reaching for. We're able to see the shortcomings and collaborate with them and their healthcare providers and their loved ones to see what solutions we can come up with. When we leave the home and we go room by room, anywhere they're going to spend time, when we leave the home, they have an itemized list printed out. We have a mobile printer in the truck now. We give them an itemized list of everything we verbally went over and discussed. They have the exact cost of what it'll take, of what it will cost to do. And all throughout, the feedback we get is we're not selling anything. It's education. We're letting folks know what exists, what could fit in their specific environment structurally, and will help them personally with their unique situation, holistically, what's going to be a fit. So they're able to never call us again. They're able to give us a green light to install everything on the paperwork that right then. They can get on the schedule that day, or they can pick and choose, and they can get some things now, some things later. We always say, you keep this in your records, you'll always have it. We can come back and do one grab bar at a time over the next 6 years, and that's fine by us. We'll come out for one grab bar, and folks are shocked that I'll come out and talk about a grab bar for an hour, and then we'll come out and install a grab bar. Oftentimes, that install will take far less than me talking about it. So it's a full service. It's an equal balance of the assessment and the collaboration with the installation. And we're all on the same page. We communicate. Anyone that enters the home is branded with the OHA. Any vehicle that shows up at your home is branded with the OHA. And we love being a resource, and we love terrific partners like yourself to keep the phone ringing and to keep the world educated that there is a solution, there is an option for aging in place safely.
There is absolutely an option. And like I said, accessibility doesn't have to be ugly, because let me tell you, my brand new Habitat home has all the high maintenance stuff with the, and you wouldn't even know it. I mean, if unless you knew, you wouldn't even know it was there. So it can be, and there's things that you guys do that people wouldn't think about. You know what I mean? There's so many things. Oh, this will be easy to fix, but you don't know it until you talk to the professionals. And that's what I like about you. Every single person on your staff is absolutely amazing. But what I want people to know is it's not just aging in place. You could help a lot of the businesses with the proverbial one step that prevents us from getting into their restaurant with your portable ramps. Tell us a little bit about that, because that seems to be a huge issue, especially in our lovely venue of Newport, where you could go
Newport.
right around for an hour and everything has that inevitable one step that we just can't access.
Yes, absolutely. I can speak at length at that. We have here a wide variety of what we call suitcase ramps. Now, what they are made for is that one step, the forgotten step, the final step to enter that is often not addressed, and it slips through the cracks. So we have everything from 2 feet to 10 feet lengths of portable ramps that can be folded in half or threefold. Most often, we're setting up the single fold ramps that fold within themselves like this, and they can be moved out of the way as needed, but we love to have them in place most of the time for access. It's not a full modular system. There's not railings. There's no pouring of concrete. There's not even a large financial investment. They're generally a several $100s. When we're working with communities and restaurants and bars and entertainment venues, we'll often donate our equipment because we're often doing other large projects there, and we're happy to donate the suitcase ramps to help for access. It's often that one step, especially in Newport, where they wouldn't have the space to pour out concrete ramps, but they certainly have space to lay down a portable ramp for moments while someone can access the store and then spend their hard-earned money and put money back into the economy. So it's only good for everyone. And I love the ramp cause to help increase the awareness of that and to help put ramps in these venues.
Yeah, what people don't understand is we're fighting for you to be accessible so we can give you our money, not to make you go broke. We're fighting to give you our money and our family and friends' money. What people don't realize too is these portable ramps help not only people in wheelchairs, but elderly with walkers and people who had just had knee surgery or back surgery and using the knee scooters, or babies' carriages going into all of these shops. So the portable ramps are such a necessity for all of our businesses out there to make sure this gets happen. So if you're a business and you're listening, call me or call Justin and look into getting one of these and let more people add to your bottom line. That is the end story right there. More money on your bottom line. I see the ramps are behind you.
Yeah, Yeah, I want to also say we were so fortunate to be asked. We were honored to be brought in by the South Kingstown Police Department when they started doing at the South Road at the old school. They started doing the vaccines there. They opened a vaccine clinic, and there was that one step curb to get up. And after the first day of the vaccine clinic, my wife Jamie was volunteering at the clinic, and they said that they had 75% folks had a walker or a wheelchair. So the next day I was able to bring, a 5 foot suitcase ramp, sit it there, and it was everyone used it because there was no curb cut on that side because they did testing on the other side with the curb cut. So we were so happy to donate that, and they used it for months and months, and they were so happy with it. So a small suitcase ramp can go a long way.
And see, that's the one thing people don't realize is they only see the disabled population, but an elderly person isn't considered disabled. They're considered elderly. So if an older person starts using a walker or a wheelchair, they're not all of a sudden disabled. They're still elderly who just uses a device. So yeah, like you said, 75%. Now, let that be a business, and now they just got 75% more business because they put a little 5-foot little portable ramp there.
Yeah.
Now imagine those numbers. Now let's get talked down to the nitty gritty. How do we pay for this? What are the options out there? Because I know that's the question on everybody's mind right now. How do I afford something like this?
Right. And that's over the years, that is what has evolved into, I'd say, our true passion. Yes, we've added, dozens of pieces of equipment, and we've made, hundreds of relationships out in the community, but it's really that funding question, because you're exactly right, Tina. This is all great, all cute equipment, but how am I going to pay for it? That's the question we get every day. So we've spent a lot of time diving into, especially in Rhode Island, how to pay for it. So the one thing that we do not leave a home, without mentioning, I probably go over this 3 to 4 times a day myself. Our office talks about it all day, every day. It's the Rhode Island Livable Home Modification Grant Program. I know this is near and dear to your heart. You helped sponsor it. You helped create it. You helped run it. The Rhode Island Commission on Disability, Governor's Commission on Disability, I cannot thank enough. I know the AARP had a lot to do with it. Of course, having it go through legislation was incredible. Representative McNamara, this grant program has been such a benefit over the past several years. What happens is the state is willing to reimburse 50% of any project up to $8,000 for retrofitting the home. So any modification that is a long list of modifications is going to be 50% reimbursed. So essentially, I think 95% of our equipment is covered. The ramps, grab bars, handrails, stair lifts, vertical platform lifts, ceiling lifts, just about everything we do, we're walking into the home with a 50% off coupon, essentially. And there's some effort. There's an application. I'm holding it right here. I go through 10 copies a day in the office. It's 5 pages long. I always say, as far as grants go, it's as easy as it gets. That being said, I don't minimize it. I understand a lot of our population that we're working with, it is overwhelming. Any paperwork is overwhelming. So we really pride ourselves in our office to essentially have our master's degree in this grant and can answer just about any and all question about the grant and can guide folks line by line, page by page on how to fill this out. I'd like to go over briefly the few homework assignments that are required to achieve the grant and apply for the grant, if you don't mind.
Absolutely.
So first of all, you're putting your name and address on the application about 4 times. That's the most writing that you'll do. The 2 homework assignments, one is you need to prove your eligibility, which is income. Now, the income requirements is as generous as it gets with grants. You can make up to $78,600 per year and still qualify for this grant. I'm going to repeat that. Most folks think I missed a digit when I say that. You can make $78,000 per year and still qualify for this. I kid you not, Tina. Folks, 99% of the time, folks laugh at me when I say that. They have a good chuckle. They say, "Who do you think I am? I'm retired. I'm on Social Security. Come on." And I say, I know. It's a generous grant. It wants folks, even that make a living and still work, to get these modifications done to keep them home, to keep them safe. They don't want you at the hospital. They don't want you in a nursing home. It's a fantastic program. It's helping so many people. We've helped hundreds and hundreds of families age in place through it. So proving that the individual makes $78,000 or less a year is one of the homework pieces. Now, also with that note, it's not household income. You can live with your loved ones, and your career, adult children career, does not factor in. A spouse's income doesn't even factor in. So that's the one of the homework pieces. You prove your income through last year's income taxes. The second is one signature from a qualified healthcare professional. Now, that can be a nurse, that can be an occupational therapist, that can be a physical therapist, that can be a doctor. Most folks that are referred to us are under some type of OT or PT care. If not, that may be a good thing. They may have found out about us anywhere else in the community, and everyone has a doctor. It doesn't even require a doctor visit. It's as simple as calling the doctor. I have it memorized. The doctor needs to agree to this sentence. I declare, under penalties provided by law, that the individual named above needs the residence modified as indicated above in order to live, here we go, more safely and independently in the community. Tina, it's not a Ferrari we're trying to get these folks.
Right.
It's ethical, it's moral, it's legal. We've yet to run into a therapist or a doctor that doesn't want to sign this for someone, because no one's trying to get something that they don't need, and that's going to really help them. So in addition to that, we have 2 homework assignments. We send in the before photographs to show the state that, look, there's no adaptation here and there are stairs to climb. Then we send in a pretty quote that says, this is how much all the work that they're going to get is going to cost. Whatever that number is, once they go through the review process, the state will award the individual 50% of our cost quote. So once this application is completed, they either email it or they can drop it off at the Pasteur Center, right in Cranston, right next to Mulligan's, the DMV, all the government center, everybody knows where it is. They can drop it off or email it. It's about a week later. They'll get their approval, and then they're able to get on our schedule, and we're able to do the work. Hundreds of homes we've helped, hundreds of people we've helped. Just about every town in Rhode Island has some modifications done through the grant. It's wildly successful. And further, we were able to educate Massachusetts State Representative Carol Doherty from Taunton about the grant. And she's gone through, it was last October, over the past several months, she's worked with her legal staff and has written a bill just like your bill, Tina, and they're presenting it in front of their legislation and going for vote. And I volunteered to testify and to speak on its behalf at length as needed. So I thought, I haven't told you that. I wanted to save it for the podcast. I thought you'd be so proud of yourself and your whole community for such a great work.
Yeah. And if they need another representative to speak, RAMP is national, so we can go speak in Massachusetts as well. So we always know that I love to speak on this program as well. And what you haven't mentioned is if you wanted to do your bathroom and use this home modification for your bathroom, and then you wanted to change your front steps, you can reapply at another time to do different projects. So it's not a one and done and then you're out of the program because you've already been granted. It's you can do your bathroom, and then when that's all said and done, then you can work on another area of your house as well. It's such a great program, and everybody needs to utilize it. Now we just need to get it permanent in the state so it never goes away, because Rhode Island is the only state, other than Virginia, I think, that has this program. Yeah.
Yes,
and
absolutely.
The other thing is,
yep.
I want to talk to the businesses out there. Do you know how businesses can become accessible and get a deal? Do you know that there are grants through the state that will give you up to 50% back from the state, then another 10% federal to make your business accessible, ADA compliant? So you're getting 60% back and getting more money from the clients you're letting into your business. So it's such an amazing process, and everybody can save money and everybody can get a deal. We're not talking rocket science here. We're talking accessibility, inclusive, and more money to your bottom line. That's what this is all about. So make sure you're calling Justin and getting this. What other options are out there if people wanted to utilize other options?
Right. So oftentimes we'll get inquiries from state organizations and more frequently now shared living situations, foster living situations. So we've done a lot of work with state Medicaid. We are now state Medicaid providers, and over the past several years have really grown in that sector. We're able to help members acquire ramps, stair lifts, and vertical platform lifts, as well as overhead ceiling lifts for $0 when they have state Medicaid insurance. So that's the anchor card, folks. A lot of times it's very confusing what insurance you have. We get it. We get the cards. We ask to present the ID cards. We have the ability to check the state's portal. We're trading partners with the state. So we're able to check on eligibility with any individual. So if you're unsure of your insurance, if you think you might be on state insurance, you may have some supplemental plans, give us a call. We'll go over it with you. It can be a little complicated, but we try to simplify it. If you're on state insurance and you have the anchor card and or the neighborhood health plan card and you're on NHP, whether it's integrity, trust, or access, those will be terms that'll be written on your neighborhood health plan card. We can help you. There's a bit of a process. It could potentially be around a month to get your authorization for your ramp or your stair lift. But when you get that authorization, we're there within a week to install the equipment for no charge at all. There's not a reimbursement. The member pays $0. The process goes like this. We acquire a doctor's prescription for the equipment. We do that via fax. That can take a few days. We ask the individuals if they have a favorite doctor that is more receptive than others and more responsive, I should say, than others. Then we'll take that one. And if it's a couple days before we get the script, we move on to the next doctor. And sometimes I've been known to show up at the door and not looking for an appointment, looking for a prescription. So I've been known to knock on doors, not knock down doors, but knock on doors to get these prescriptions. And when the doctors and when the receptionists see me and understand what we're looking for, we're more than just a voicemail at that point. They're often very receptive and will sign off. So it's a prescription. Then we need an occupational therapist or a physical therapist to complete a needs assessment. Now, there's about 10 questions on this needs assessment. It's asking about the functional presentation. How's the individual getting around now? What are their limitations? It asks about the home. It asks about what other equipment may or may not have been tried. It asks if the equipment will fit. And it has basic demographics on it. So once we acquire that, we put together our prior authorization form. We put together our quote. And we put together all the before photos. We're able to submit to the state for prior authorization. They then have 14 days to approve or deny the products. Once we get the approval, we're there, like I said, within a week, and we're able to install all the equipment. At any given time, we have 6 to 10 Medicaid or NHP files going on that we're helping folks. All the case managers out there, we thank you so much for helping navigate the system, working with us, helping educate folks that these programs exist. Most folks don't realize they exist. I believe we are the only company, access company, that is going through Medicaid at this point as a Medicaid provider. It is a grueling process on the claim end, getting paid on our end. That's not anyone's problem. I don't need to talk about that. We're here to help, and we think we're a great resource, and work with all the state organizations. Also, state insurance is United Community Plan. Be careful. It's not United Medicare Advantage Plan. They don't want to help yet, but United Community Plan is a form of state Medicaid that will absolutely help acquire all the equipment that we do with the ramps and the stair lifts.
And that is amazing. And yes, we are very vocal with all of the other insurance companies to get them on board as well, because they're learning how much money it actually saves them by helping out and keeping us out of the hospital and keeping us aging in place. But I want you to toot your own horn right now, because I'm going to do it for you if you don't. You just won a very big award, and that's why people should use you. So tell us all a little bit about the big award you just won, because I am so proud of you.
Oh, thank you so much. Yeah, I consider, first of all, I want to say I consider it a team award. It takes every single person on this team in Oakley Home Access, from Mike Vieira to Alex Denoncourt, Sydney Erickson, everyone involved, Dominic Colombo, Michael Sullivan, everyone here is equally, deserving of this award. I just happen to be the occupational therapist. So we took home the Rhode Island Occupational Therapy Association Occupational Therapy Practitioner of the Year. So we're very honored to accept the award. And Ryota's a great association. They spread a lot of awareness and bring all of us OTs together, and really just spread awareness about the value of OT. And when I accepted the award on the annual spring meeting that we had, it was just so it was heartwarming and riveting to see the screen of the dozens and dozens and dozens of therapists that, I work with all their clients, and they refer all their clients to me, and it's just so heartwarming that we're all on the same page and we're all working together. And it was wonderful. All the other award winners I have, significant relationships with, and we help a lot of the same folks. The Community Impact Award, Carolyn, that was one of my first health fairs ever in 2015, when she was the senior program director at the YMCA. And now she runs the show with Rocksteady Boxing, and it's just so wild. How much, how many relationships we've been able to create and how many people we've been able to help. But I have to emphasize that it's a team award, and it wouldn't exist without my team here at OHA and all the incredible therapists and healthcare providers out in the community doing such great work.
It's so true, but to be recognized by your peers and to win such an honor, this is why people should be using Oakley Home Access. And if that is not enough of a ploy for you, we partner with Oakley Home Access on a daily basis, and we just took home the Caregivers of the Year Award organization for Rhode Island. So now you have two highly recommended Rhode Island organizations that have been recognized for help in this community. So why would you not respond to Oakley's and us to make sure that you are aging in place and you have every piece of equipment that you could possibly want? You can't go wrong with going with us. So just letting them know. But I want to say that I'm very, very proud of you for that. So give us some upcoming things that are coming up and where people can find you, and what else that you guys do.
So I did want to talk mostly about funding, and I'm glad we really focused on funding. are two new products, new innovative products that we've been fortunate to be partnered with and to be offering now. I wanted to just mention that briefly. One is, Tina, all about the curved stair lift and how unique they are and how customized they are. Tina, the one that you have will fit nowhere else. That is only for you and your stairwell. Now, for the first time ever, we're partnered with a different stairlift company in addition to Handicare, who we still know and love. Up now is offering modular stairlifts for the curve. So we're able to now finally rent curved stairlifts and set them up for temporary situations. Now you're in your forever home, so that's fantastic. Some folks may need a curved situation for a year or two and then plan on moving to another situation that potentially could have stairs. This is the only stair lift on the market that we can take apart piece by piece and then set up somewhere else. It's a game changer for us because we hate saying no to folks. And unfortunately, with the curved stair lift situation, we've had to say no when it was a temporary situation. And also, we're able to install these the next week. Whereas, as you know, 6 to 8 weeks manufacturing takes to make a permanent curved rail. So this is a game changer for us. We're very excited. I think it's a cool looking chair, and we're really excited about it. The other thing I have to mention briefly, we now are able to install residential elevators, complete elevators. However, there's no mechanical room. There's no intense shaft. There's no invasive site prep, minimal site prep, but this is able to take up 8.5 square feet, and simply a hole in the floor and ceiling is able to create this situation. So those are the new things we're doing. Michael's really excited about those. He's leading the charge on both of these units. My partner, Michael Vieira, his just incredible construction background has really primed him for these new innovative products that we're working with. Whereas I'm always the most passionate, of course, in the bathroom as an occupational therapist. That's just the beauty of our company. The yin, the yang, and the balance is what makes us who we are.
And what people don't realize is these items add to the value of your home. They are appealing, they are useful, whether you're in a wheelchair or not, but they bring to the value of your home. I know during COVID, we used a lot of people who had the elevators to do contactless delivery. We would have all the delivery put in their elevators and brought up to the patient, so that way they would not have to have contact with anybody or risk getting sick. So there's so many uses for these elevators and stair lifts, and they're beautiful. They're absolutely beautiful what they do, and they add to the value of your home. So if you're going to plan on selling your home, or somebody who uses it passes away and you want to move on, these absolutely don't need to be taken down. They don't need to be taken out. They're actually a huge, huge selling point because there is no stock in Rhode Island right now. We're trying to build it up. So leave it and sell it as an added bonus to your home. This is what people don't realize. It's just an amazing event. But tell me some of the interactions that you have with people and how thankful that they are of how quickly that you can get them taken care of and keeping their loved ones at home, especially during a pandemic.
Yes, it's always a challenge. When folks call us, we always say 90% or so calls that come in are crisis management. It's what now? X, Y, or Z happened, and now we're up against it, and we need to get mom or dad home, and the home's not ready. And folks are saying ramps and stair lifts, and they don't know what that means. So we're fortunate enough that they call us. They During COVID, what changed was the loved ones were not able to sit in the rooms with the patients, with their loved ones, and watch the therapy session and be involved with the care and see what they were working on and talk to the therapist and communicate. That was a big challenge. When we would show up at the home, they wouldn't know how mom was getting around. They didn't know if she was going to come home on a walker or a wheelchair or a cane. They didn't know how she was transferring, if she was transferring by themselves or one person or two person. We created a customized list of all relevant questions that day they would call the nursing home and get these answers and start the collaboration. We prided ourselves on being that translator between the therapy department and the loved ones that are trying to get their other loved ones home. So the feedback we got from that was incredible. They just folks felt so much more comfortable. They were able to get the equipment they needed in a timely fashion, and it was just such a relief for them. On the other hand, let's not forget the 10% of the proactive calls that we get. We cherish and love the 1 or 2 grab bar call as much as the 50-foot ramp call that we get. A great little story that happened to us just this last week. It was an aging in place call. It was a proactive call. The individual used a cane. She was in her 60s, had a knee surgery for a knee replacement from wear and tear. She said that she had sat on my card, that a therapist had given her my card 4 months prior. And she was so afraid that A, I was not going to call her back, or B, I was going to try to sell her entire bathroom remodel, that she just didn't call. And she avoided her bathroom, and she feared going in there. She eventually called. She got on the schedule. We did our assessment. Nothing special as far as I was not any more cautious of her wariness. I had no idea of her wariness. I didn't know how long she had the card. And at the end, she said, I just have to tell you, I felt so comfortable during this, and I've sat on this card for 3 months not calling because I thought you were going to try to sell me things I didn't need. And she's like, I just wanted to let you know this was so smooth, and I felt so comfortable, and I cannot believe you're going to have a technician crew come back for these 2 grab bars. And I said, that's what we're built for. That's what we're passionate about. That's what we created the business for. Michael and I's first 15 jobs together, when we were holding hands going into each house to evaluate and then to install, we lived off 2 grab bar jobs. It's our backbone. Getting in and out of the shower was the epitome of why we started, and it turned into everything else you can imagine to age in place. So it's extreme jobs, and it's the very simple jobs that really keep us running and keep us passionate.
But I think what keeps you going for the public is your honesty and your straightforwardness and not overselling anybody. And the other thing is your employees, because I'll tell you, the 2 guys that came out to install my stair lift dealt with my 190-pound Great Dane and my 80-pound pit bull like they were 2 10-pound dogs. No issues at all, letting them lick them, making sure that they greeted them before they did anything else, like babying them first. They were absolutely amazing. Beginning to end, it was absolutely, and like I said, I'm like, if you guys want me to lock the dogs up, I will. I don't usually, but I will. And they're like, absolutely not. They were great. So every aspect of what you guys do and every employee that I've come in contact with is above and beyond. You pride yourself on that, and that is what keeps you guys going, because that keeps your name out there. So like I said, everybody out there, call Justin, get an estimate, be proactive if you can, but if it's last minute, still call Justin, because they will be there for that too, because him and Mike are above and beyond, and they will make sure that they get you what you need, because they don't get bothered by anybody more than me. Can you help this one? Can you help that one? Can you do this? So I'm constantly calling them. So it's just a great aspect. But give us your final thoughts and the last thing that you want everybody to know most about what you do.
Well, I just want everyone to know that we're here for you. We know oftentimes when you need to call us, it's a challenging time. We're going to make it simpler. We're going to simplify it. We're going to give you options, and we're going to maximize your mobility, and we're going to help keep your loved ones safe at home. I want everyone that knows someone that could benefit from a home modification. You don't even need to call us. Call someone to get on the grant program. Any contractor can do it. If your loved one is a handyman and can build you a ramp, they can do the grant program. Get the modifications done, improve your housing stock, stay at home safe and sound. And I think, Tina, next year we should shoot for $1 million for this grant.
Oh, absolutely. Well, we're first shooting to get it permanent so it never goes away. Because right now it's year to year. So we want it permanent first. But the other nice aspect is, what is the one thing from Ramp that you give out to every one of your customers? I'm going to let you share.
I have it right here, of course. This is the famous Red Badge program. Instead of having your emergency contact information and your special needs, any allergies, medications, important aspects, instead of it tucked away on an iPad or on the fridge, it's right there on you at all times. If the rescue ever needs to come or you need help from any individual in the community, you zip that open and you got everything you need. We hand them out to clients all the time. Now health fairs are going to be a thing again. We'll always have them at our booth. And if you're a business or you're dealing with people, buy some of these from Tina and give them out to your clients. I'm talking to all the home care companies out there, talking about all the geriatric care managers out there, and I'm talking to all the skilled nursing facilities that are discharging folks home, and all the assisted livings for that matter. Get these bags from Tina and give them to your people.
Yeah, they're great. And what I want everybody to know is it's a global initiative because we have partnered with FEMA. So FEMA gives these out when they go all over the world, because when I did a cast for over 10,000 emergency first responders, I had not one negative response because I said it's non-tech based, it's on you at all times, and it's easily updated. It's one of the best initiatives that we came up with, and that started right here in little old Rhode Island. It's the Ramp Red Bag Initiative, and you can go to www.rampisinclusion.com to grab your bag today. And what you need to know is in that bag is a little card that tells you exactly what should be in that bag and fills out all of the information for you. So make sure you get it. So if you can't get one from me, make sure you stop by one of Justin's booths and you grab one from him. So thank you so much, Justin. We are so glad to partner with you, and you are a big supporter of us as we are of you, because we're in the same business. But I want to thank you so much for joining us today, and I can't wait for more and more people to get to meet you and work with you and really, spread the word of how much wonderful stuff that you do. And that's not just homes, that's businesses too. Justin does both, homes and businesses. So no matter what you own, call Justin. Can't get Justin, call me and I'll get Justin for you. So thank you so much, Justin. Have a good night. I want everybody to join us back here next Wednesday night, because we will be talking to CareLink next week, and you can learn all about what they do for the community. So we're very excited about that show as well. So thank you, and see you all next week. Bye, Justin. Have a great week.
Bye, Tina.